Yeah, I was just saying, let's go ahead and get started. Welcome, everybody. It's great to see some familiar names, and even greater to see some unfamiliar names in the list of attendees here. Welcome to session 2 of the Emerald Choral Academy. I'm Gary Cannon, the artistic director of the Emerald Ensemble, which is a professional choir based in Seattle. The Emerald Choral Academy is a series of interactive webinars during which our area's leading professional choristers will reveal their personal tricks of the trade to community singers. These webinars will then be made available freely to singers across the world via the internet. The Emerald Ensemble is very grateful to our generous donors who have made this project possible, particularly the Seattle Office of Arts and Culture. We encourage anyone participating or viewing this webinar to make a donation as you are able at emeraldensemble.org. You can also subscribe to our YouTube channel and join our mailing list to hear about future sessions of the Academy and the other activities of the Emerald Ensemble. This webinar is being recorded. By participating, you are granting the Emerald Ensemble permission to share your contribution. Please ensure that your microphones and cameras are turned off for the duration of the presentation. You can ask questions to the presenter by typing into the chat feature at the bottom of your screen. The Q&A feature will work as well. And periodically, then I'll interject to field your questions. There will also be a designated Q&A period at the end of the presentation. Thank you for your patience. This technology is still new to us. There are bound to be a few more bumps and bruises along the way. Yesterday, you received a confirmation email that included a PDF handout. You may wish to access that now, and there's a link in the chat as well somewhere. Scott, maybe you can share it again since it's probably up there. No worries. There's also a link to that further up. This session's instructor is one of my very favorite people to work with. She is soprano Holly Boaz. Holly is active in opera, oratorio, and chamber ensembles with a particular affinity for the Baroque era. If you have never heard her sing Handel's Messiah, you are lacking one of the wonders of the musical world, I would say. Holly teaches privately in the Tacoma area and on Vashon Island, as well as at Pacific Lutheran University and Tacoma Community College. Her topic today is Vocal Anatomy 102, Alignment and Breath. It is a pleasure to introduce to you my friend and colleague, Holly Boaz. Yay.
Thanks for that, Gary. Gary, why don't you stay unmuted just for a second while I try to share my screen and make sure everything comes up correctly.
Sure.
If you don't mind. How is that?
I see your screen.
Can you see my pointer?
I see your swirly red pointer.
Hooray! Okay, thank you.
You're welcome.
Hello, everyone. And to those of you who were with us for Vocal Anatomy 101, welcome back. To those of you who are new, I will do my best to review the main concepts that we went over in the last presentation that pertain to today's information. So, and I also want to say again, this is a very shallow overview of breathing and alignment, but there will be no shallow breathing, not that. But for lots of more information and for lots of additional exercises that you can take and do for self-exploration, please do explore the resources that I've listed at the end of your handout. There's a lot this time because it's a big topic. Today, we're going to cover the basics of the physics of breathing, the bony structures. We'll review the primary muscles of breathing, which we talked about last time. We'll talk about some specific different ways to move the structure for breathing. We'll talk about a few cross-body connections that might not be automatically obvious that have to do with our breath. And then we'll talk about overall alignment and its effect on our breath. But let's start today with some physics. Hooray! So the physics of breathing all boils down to Boyles Law, and that's for Gary Cannon. You're welcome. Boyles Law, according to the Encyclopedia Britannica online, This empirical relation, formulated by the physicist Robert Boyle in 1662, states that the pressure of a given quantity of gas varies inversely with its volume at constant temperature. So in equation form, that's pressure times volume equals a constant. As pressure increases, volume decreases, and vice versa. How does this pertain to breathing? Well, I got this from Cliff's Notes online. Breathing occurs when the contraction or relaxation of muscles around the lungs changes the total volume of air within the air passages inside the lungs. When the volume of the lungs changes, the pressure of the air in the lungs changes in accordance with Boyles Law. If the pressure is greater in the lungs than it is outside the lungs, then air rushes out, and vice versa. So in other words, when we inhale, we use muscle activity to increase the volume of the thoracic cavity and create an area of lower pressure in our lungs for air to rush in. When we exhale, we decrease that volume, thereby increasing the pressure, so air wants to rush out and seek an area of lower pressure. So let's look at a picture to illustrate that idea. You can imagine these are lungs, although they wouldn't be doing the opposite things in our own bodies, so it's kind of funny to think about. But anyway, in both of these vessels are the same number of air molecules or gas molecules of some kind. And if you see on the left side, it's quite a large volume. Volume increases, there's more room for those air molecules, so there's less pressure. Volume increases, pressure decreases. And on the right side, you see the volume has decreased, so there's less room for those molecules to bounce around, so the pressure has increased. So if you think about this in terms of breathing, here is the scenario where we open our thoracic cavity and make more room inside the lungs, then air will want to rush into this area of lower pressure. And when we make the thoracic cavity smaller, we decrease the volume inside our lungs, we increase the pressure, and that air wants to rush out. So this is the main theme of sort of what connects all the threads today. When we increase the volume of our thoracic cavity, air is allowed to rush into our lungs. When we decrease the volume of our thoracic cavity, air rushes out. So let's look at the bony structures involved. Here we have a picture of the human spine. We have 7 cervical vertebrae, 12 thoracic vertebrae. These are the ones that we're going to talk about the most today. We have 5 lumbar vertebrae, and then the rest of them are fused together into the sacrum and coccyx or tailbone. A typical spine has 4 curves, slightly forward in the cervical area and in the lumbar, and slightly outward in the thoracic and the sacral. And in between all of the vertebrae, except between the very top 2, the atlas and the axis, are spinal discs. These act as shock absorbers and as joints to allow for some mobility, and they also hold the vertebrae together. And the spine is further strengthened and held together with ligaments, tendons, and fascia, allowing for a flexible but stable structure. And attached to the spine is our rib cage. The rib cage is also known as the thoracic cage. It's a bony and cartilaginous structure which surrounds the thoracic cavity. A typical human rib cage consists of 24 ribs in 12 pairs. Not all of them, but most of them. It also contains the sternum and xiphoid process, the costal cartilages, and the 12 thoracic vertebrae, which is hard to see behind the rib cage here. Ribs are described based on their location and connection with the sternum. All ribs are attached in the back to the thoracic spine. They're numbered 1 to 12, with 1 being on the top and 12 on the bottom. And they're labeled true ribs and false ribs. And if you look at the image on the right side of your screen, you'll see the true ribs are those outlined in red, and they connect directly to the sternum. The false ribs are the green and blue ribs that don't connect directly. The first few pairs of false ribs actually do connect into the sternum, but they connect through the cartilages, not directly. And then finally, the last two pairs are the floating ribs, and they don't connect to the sternum at all. The function of our rib cage is to protect the heart and the lungs. And if you look at the middle image, you can see an outline of where your heart would be. You can see the outline of your diaphragm muscle, which we'll look at some more in a minute. And the basic outline of where your lungs take up space within that thoracic cavity. So the rib cage protects those organs, and it expands and contracts as part of the respiratory process. The lungs inside are connected to the rib cage by the pleural sacs, and please recognize this is a very oversimplified view of this, but it's kind of a neat way to think about it. The pleural sacs are these stretchy and movable things covered in fluid that keep the ribs in contact with the inside of the rib cage. And I've had someone describe these brilliantly like a wet shopping bag thrown against a window. The surface tension of the fluid between the bag and the window keeps it stuck there, but you can still move it around. So that's kind of how the lungs are allowed to glide against the inside of the rib cage and our intercostal muscles with that fluid between the pleural sac. Okay, so we've looked at the basic physics involved. We've looked at the bony structure. And now we're going to review the muscles of inhalation and exhalation. But before I do that, let me just check in and see if there are any questions.
I don't see any questions on the side. Feel free to type any in, folks, at any time. I do have one question. We tend to think of bones as being very solid structures. How much variety is there between the solidness and the flexibility of the bones that you've just talked about?
I'm not sure I'm quite understanding your question. What I can say is that all of the places, so the thoracic spine, which the rib cage is attached to, every single one of those vertebrae in the thoracic spine has that disc in between, which allows for some articulation, for some movement. So, and I'm going to talk about this some more a little later too. Maybe this is sort of what you're getting at, Gary, but the thoracic spine itself actually has more range of motion than most people take advantage of on average, at least in our culture. The rib cage does have some flexibility to move where it attaches to the sternum in those costal cartilages, and most of that movement is done by the intercostal muscles. Does that kind of help answer that question?
Yeah, so it's about how the bones and the cartilage react together is what will give some of the ribs the flexibility they need to expand or contract.
Right, but the bones could not move without the activity of the muscles. So let's be clear about that.
Right, okay.
Yeah.
Good, thank you. And thank you for starting out with the Boyles Law pun. That's much appreciated. I don't see anything else typed in, so I'd say
okay.
we're good to keep going.
Onward. Hello. Okay. So here we'll review first the primary muscles of inhalation. So these are the muscles that activate when you breathe in. The first, of course, being our diaphragm, and we'll look at this in more detail in a moment, but here's the outline of that diaphragm up into the rib cage. The next and the main muscle I want to focus on in the movement we're going to talk about regarding the expansion of the thoracic cavity is the external intercostal muscles. These muscles sit on the outside of the rib cage and connect one rib to another all the way through the rib cage. Their job is to contract and pull the rib that they're connected to on bottom to the rib that they're connected to on the top. And by doing that, all of these muscles are in effect lifting and opening that rib cage when we inhale. At the same time, the diaphragm is engaging and descending. And then we also mentioned last time the secondary or accessory muscles of breathing, and we'll take a closer look at those today. We have the sternocleidomastoid, which is quite large, that runs from your mastoid process across your neck and attaches into the sternum. And then underneath the sternocleidomastoid, we have the 3 scalene muscles. Here's the middle scalene, there's the anterior scalene that's a little more in the front, and the posterior scalene that's a little more in the back, and we have these on both sides. And what's important to keep in mind about these muscles is that as singers, we may want to avoid using them very much, partly because our neck musculature in general tends to be a little overused because a lot of us have forward head position going on, largely due to all of our cell phone use, our computer screen use, our driving habits. So that's something to be aware of. And the other reason why we might not want to engage them as much as our primary muscles of breathing is because they tend to be involved with what I call the stress breath, which is associated with the fight, flight, freeze response in our sympathetic nervous system. And if we're performing or singing, we want to have a certain amount of calm in our bodies, and that stress response can exacerbate production of adrenaline and make our heart rate faster. So it might be a nice thing to try and avoid. Okay, now we're going to review the movement of the diaphragm once again. So let's remember that the diaphragm is an involuntary muscle. There is some controversy over this because you can decide to breathe and make your diaphragm move. But you can't just engage your diaphragm like you can engage your bicep. It's different. The diaphragm sits up inside our rib cage, attaches all along the bottom. Notice that there are fibers in the back of the muscle that attach to our lumbar spine. Remember that the diaphragm is only engaged on inhalation. When we inhale, the muscle contracts and descends, and it also helps to flare open the bottom of the rib cage, thereby opening the thoracic cavity, expanding the volume therein, allowing air to come into our lungs. Now, while we're looking at the diaphragm, I'll throw a couple other little tidbits out there that might affect breathing function. One of those has to do with the attachment here at the lumbar spine. If you are a person who experiences instability of your lumbar spine, or you have chronic lower back pain, this could be something that potentially affects your diaphragm function and your breathing patterns. So that is something to be aware of. Here's another interesting cross-body connection. The diaphragm shares tissues with another muscle, the psoas, which is a very deep muscle in the body. It's responsible for hip flexing and for stabilizing the inside of our lumbar spine. And here you have one on both sides. And you see it attaches to the lumbar spine awfully close to where we saw the attachments of the diaphragm. The psoas is actually attached to the diaphragm through fascia and ligament. And with each breath, the psoas moves with the diaphragm to provide stability to the inside of our lumbar spine. If there's tightness in your psoas muscle, or if it is shortened, it can adversely affect diaphragm function and vice versa. And as it turns out, a lot of us have shortened or tightened psoas muscles because every time we sit, we are shortening that muscle. So I recommend to all of my singing students to try hip flexor stretches to allow that psoas muscle to lengthen once in a while, and that can have a positive effect on your breathing function. It can also have an effect on lower back issues. So interesting cross-body connection there. Moving on, let's review those muscles of exhalation. Now remember, these are muscles that we engaged on a controlled exhalation. If we're simply exhaling at rest, there's really no muscular activity required. So the main muscle of exhalation, when it's a controlled exhalation, is the internal intercostal muscles. And these are the antagonist muscle to the external intercostals. The internal intercostal muscles, again, are between each rib, this time on the inside, and their job is to pull the top rib they're attached to down to the bottom rib, thereby lowering and closing in the thoracic cavity. Then we also have the muscles of the abdominal wall. And the innermost muscle, which I'm sorry you can't see very well here, is the transverse abdominis. And this is the horizontal fibers, big wide muscle that comes all the way around your body. And you can think about it like a very wide elastic belt. On top of the transverse abdominis are our internal and external obliques, which help us with twisting motions. And then on the top, in the front, is the rectus abdominis, which connects the rib cage to the pelvic bone, and that would be your six-pack abs. We also have the pelvic floor involved to some degree, and it tends to move in a sort of sequential way with the diaphragm. But like the diaphragm, we have very little kinesthetic sense of our pelvic floor in general, and often, especially in bodies who have been pregnant or given birth to children, often we have some level of dysfunction or change in the pelvic floor that might change our breathing patterns. Okay, now we've talked about the physics, we've talked about the bony structure, we've reviewed the muscles. Let's talk about how to move these parts in ways that are beneficial for singing. And I love this quote by Sarah Witten, who's a wonderful voice teacher, yoga teacher. She specializes in helping voice users overcome alignment issues or physical, perhaps injuries that you're recovering from that might be affecting your voice use. She says, the optimal breath is the one that will most efficiently facilitate the sound that you want. There it is. Melissa Malda, from What Every Singer Needs to Know About the Body, says, singers are not average breathers. We breathe to sustain tone as well as life. Although the muscle, bone, and cartilage used in breathing are essentially the same for everyone, they can be coordinated in different ways. Consequently, there are almost as many breathing methods as there are singers. So let's acknowledge there are many, many ways to breathe, and not necessarily one size fits all. But we know we need to expand the thoracic cavity in order to decrease the pressure inside, or in order to decrease the pressure inside of the lungs and allow air to enter. How many ways are there to do that? Well, there are lots, but let's look at 3 specific ones today. The first one we're going to look at is probably something you've all heard of, the belly breath or abdominal breathing. Unfortunately, this is often also referred to as diaphragmatic breathing, which is a really big pet peeve of mine because we know that every breath is diaphragmatic. Every breath involves the use of the diaphragm. But anyway, in this method of breathing, we allow that downward expansion of the diaphragm, and that diaphragm needs to go somewhere. And there's stuff underneath it, right? So we have inside of our abdominal cavity, which is directly under the diaphragm, a bunch of stuff, organs and other viscera. Where does it go when the diaphragm descends? Well, that's where the release of the abdominal wall comes in. Our abdominal cavity is of fixed volume. Our thoracic cavity is not, because we have this opening where gas can come in and out and increase the volume or decrease the volume. But our abdominal cavity is basically fixed volume. So we, instead of expanding it, we change the shape of our abdominal cavity. So when that diaphragm descends and those viscera need somewhere to go and our abdominal wall releases, that's when we see what we might refer to as the belly pooch. And we might notice this range of motion all the way around the body. Some bodies feel it, especially in the back. Some feel it almost exclusively in the front. It's very unique to each body. This range of motion might be especially noticeable in bodies that have that extra organ, the uterus, down in there, and bodies that have particularly well-developed or tight abdominal muscles might notice far less range of motion in this type of breathing. And then in this style of breathing, upon exhalation, the abdominal muscles gently contract, guiding the viscera back toward the diaphragm, encouraging the diaphragm to ascend back into the thoracic cavity, decreasing the volume. So in this type of breathing, belly breath, abdominal breathing, most of the range of motion is felt in the abdomen. But let's be very clear that we're not taking any gaseous matter down into our belly, right? The air only goes into our lungs. We're just feeling that range of motion in response to the descent of the diaphragm. Now let's look at two other main styles of breathing. So we can focus the expansion of the rib cage in other ways. And in chest breathing or thoracic breathing, we feel that range of motion laterally in the rib cage and from front to back. And we feel less range of motion in the abdomen or in the abdominal wall. Usually this is where the average person could afford to expand their range of motion. And I would say, especially in current times when the COVID-19 is looming over us, and we know that the better we breathe, the better we'll do if we happen to catch the virus. And I'd like to recommend very strongly a couple of podcasts by biomechanist Katie Bowman that were released recently. You can find them and listen to them for free. And they are listed in your resources at the end of the PDF file. She suggests some really wonderful exercises that help you expand your range of motion in the movement of your thoracic cavity, mostly the lateral and the front to back. And my favorite one that she talks about in one of these podcasts is one where you can take one of those stretchy exercise bands and wrap gently around your ribs. Or if you don't have one of those, you can use some pantyhose or a pair of tights. And you breathe and stretch into that band or those tights that have a little give to them, but give you lots of kinesthetic feedback. So that's something you can try. So we talked about abdominal breathing, we talked about thoracic breathing. We can also talk about clavicular breathing. This is a useful strategy in many situations, although it's often discouraged for singers. And with good reason, because then we're activating those accessory muscles of breathing to raise the rib cage toward the skull. And we don't want to do that very often. But given certain circumstances, or given certain unique aspects of a particular body, you might find that clavicular breathing is very useful for you. And of course, we can combine all of these styles of breathing in different ways to come up with unique strategies for given circumstances. Things you might consider as a singer. What is the phrase length I'm about to sing? What is the contour? What is the volume? Am I using amplification or not? What are the forces that work on my body? Am I, for example, wearing a corset, which might give me some limitations on range of motion? Or am I carrying something heavy? Am I holding a choir folder? And we could have a whole show on folder shoulder. Am I moving? Am I sitting, standing? Am I dancing? And what is my physical position? Am I lying down? Am I leaning over something? These are all things that might affect which breathing strategy you choose or how you combine them to work most efficiently in that given situation. I'm going to tell you about a quick exercise here that you can take and work on at home. It is also included in your handouts. And this is a variation on a yogic practice called desha breathing, desha being a particular point in the body upon which you focus your awareness. You can do this standing, sitting, on all fours, hands and knees, or you can do it laying on your back. Just be sure you support your head a little bit. You've got your knees bent and your feet flat on the floor. You always will start by allowing your breath to relax to what you might call a normal at rest pattern of breathing. At that point, you'll decide to focus on one of these particular areas. I usually recommend starting with the abdominal breathing. So you will allow the maximum range of motion release in the abdominal wall as you inhale, and notice where in your body you're feeling that movement. Are you being successful in releasing those abdominal muscles? And do a series of breaths with that focus. Then let that focus go, return to your normal breath cycle. Change your focus. This time, maybe you'll do some thoracic breathing, and you'll focus on that outward expansion of the rib cage, either laterally or front to back or both. You do a series of breaths with that particular focus. Let go of the focus, come back to normal breathing. Perhaps you try the clavicular breathing. And if you get really good at this and you're very comfortable with it, and it doesn't raise your heartbeat, and it doesn't make you anxious, then I would suggest trying one and then another. So you can take one breath in that is focused on the abdominal range of motion, and then the next breath in might be focused on the expansion outward of your rib cage, and back and forth. So you can get as fancy as you want. Now, this brings me to, this term we've all heard and we all talk about, breath support. And what the heck is breath support anyway? And if you ask 10 different voice teachers, you'll get 10 different answers. I guarantee it. Some of them might have some similar thoughts, but we all are so unique that we feel our breath in a different way. And so our thoughts on what breath support is or how to manage our breath are going to be different. But what I can say is that in our Western Eurocentric classical music tradition, especially in the academic context, what is usually taught is a variation on the bel canto tradition. And the foundation of what we would consider breath support within that bel canto tradition is what we call the appoggio. Appoggio comes from the Italian verb appoggiare, which means to lean. So the appoggio is a feeling of leaning. And it basically consists of an inhale that includes full range of motion in the expansion of the ribcage laterally, and full range of motion in the release of the abdominal wall on your inhale. And then when you sing, you control the flow and pressure of air as it passes through the glottis by gently engaging the muscles of inhalation at the same time as the muscles of exhalation. This is muscular antagonism. And that is what creates that leaning feeling. Some might describe it as good tension. Some people describe it as the feeling like you're pulling taffy, that it's this consistent feeling, and it does have a sense of support in it. But whether or not you find this method useful or you relate to your concept of breath management totally differently, breathing for singing isn't that different from breathing for everyday life, in that what we want is efficiency and ease. And before I move on to sort of an overview of alignment in general and how it affects this process, I will pause here in case there have been any questions arise.
We do have a couple, and thank you for mentioning that variable of the variable in that there are various versions of thinking about support. And sometimes I think when I use the term, I mean different things each time as well. One question is regarding asthma. Are there any exercises that can help singers who are asthmatic?
Yes. Okay. First of all, something that has been recommended to me from other pedagogues who I greatly admire is buteyko breathing, which is, it's not something that's generally used specifically for singers who are experiencing asthma, but it's a general thing for those who suffer from asthma that can help with the ease of the breathing process. And I am not an expert in buteyko breathing, so I will just say take that name and go explore that. But I can also recommend Sarah Witten, who I quoted a little earlier in the presentation. She's the one out in Massachusetts who teaches yoga and singing and works with singers on overall body stuff as it relates to their voice use. She has a fantastic workshop that is specifically for singers who experience asthma, and she talks about, well, she comes at it from a lot of different directions, but she talks about various ways in which to increase range of motion so that you're using more of the lobes of your lungs, but also ways to calm your nervous system, to activate your sympathetic nervous system, because when an asthma attack begins, it tends to put you in fight, flight, or freeze mode. And so that's another piece of the puzzle that can be very useful for singers.
I love that there are people with these kinds of specialties that have delved into just that variable. That's great. Similarly, a question regarding yoga and psoas function.
Mm-hmm.
How do yoga exercises for psoas correlate to singing? Would you find them to be helpful specifically?
Yes, I do. In fact, I am a yoga teacher myself, and I do ask my students to assume yoga poses or versions of yoga poses occasionally. I'll talk about some more of what I do along that line at the end of the presentation today, but specifically any pose that puts you into a sort of high lunge. So I'm thinking of things like warrior 1 or 2, or similar poses that stretch out in the front of your hip will allow that psoas to lengthen. Now, I also want to put a little caveat in there. Whenever you're lengthening a muscle, make sure you're already also strengthening that muscle and the muscles around it so that it's supported. You're not just lengthening it all the time so that it loses its strength and ability to contract. But yes, I find yoga to be extremely helpful for folks who have lower back pain, who have very little range of motion in their thoracic cavity, and who have tight hips or issues that arise from shortened hip flexor muscles.
As I'm sitting here at the computer with shortening my hip flexor muscles to the shortest they can get, I think I doubt I'm alone in that perspective, needing work there. One final question before I let you go on is kind of, especially in choral music, we deal with so many different cultures now from around the world. How do these breathing techniques relate to traditions outside of Western bel canto? Or is this beyond the ability for today? And if so, how could one learn more?
That has just made all kinds of light bulbs light up in my head.
Great question.
I don't know how to answer that question, but I sure as heck want to go look into it.
We might have to reserve, it's such a good question, in fact. We may have to reserve this for a whole session someday of this academy, because there's so much that could be gone in there. That's great. Thank you.
What I would like to throw in there, which probably doesn't answer your question at all, so apologies for that, but it is worth knowing that there are other significant schools of thought around how to teach breath support. One of those that you'll run into a lot is a method that is in German by origin, which is sort of the opposite almost of appoggio, where it's taught to sort of push out the belly. And I know for some singers, it works great and they love it, but it's kind of the opposite of what we're talking about with the appoggio. And so I think it's called Bauchen, oh gosh, I can't remember. But anyway, it's something you might run into, and it's something you might hear voice teachers talking about, down and out. So interesting.
Great, thanks very much. Let's hear what you got next.
Okay, let's see if I can make my slide move here. Hello. There we go. Okay, so we're going to talk a little bit about general alignment and how it fits into all of this stuff. And I have another lovely quote from Melissa Malda from What Every Singer Needs to Know About the Body. For breathing to work effectively, the body must be in balance. When we are in balance, we can rely on the suspension system of bones, fascia, ligaments, tendons, and deep postural muscles, like the psoas, to keep us buoyant. The muscles used for breathing are then free to make the movements of inhalation and exhalation. If we lock or brace any part of the body, this elastic balanced system is compromised and breathing becomes less effective. And I would add, more effortful. So let's look at how alignment plays a role in making this either more effortful or less effortful. And what do I mean by alignment anyway? Is it the same thing as posture? I would say posture implies a static, held pose, whereas alignment allows for movement. And since singing is movement, let's use alignment as our better term. Maybe balance is even a better term, but we'll stick with alignment for today. Claudia Friedlander is a New York-based voice teacher, personal trainer, and a social justice activist within the artistic community. If you don't know about her blog already, please go explore it. It's in the resources. She says alignment is inherently dynamic and therefore cannot be defined as an ideal position for singers to emulate. I think this sums up how I feel about alignment, both as a term and as a concept, and I love her use of the word dynamic. Our instrument is dynamic, and our alignment is really about arranging parts relative to one another, not about static and held postures. She continues, what our vocal instruments require are spines free of postural distortions, dynamically stabilized rather than rigidly held, so that we can activate the internal moving parts and vibrating structures that contribute to singing while remaining externally free to dramatic and embody our roles. So, in a nutshell, the goal of alignment is to provide ideal conditions through which our bone structure can hold us up efficiently without much effort, so that our muscles and other moving parts are free to do other stuff, like breathe and sing. Those muscles don't have to engage and tighten for the purpose of holding us up or keeping us from falling over. So let's look at a very general way to self-assess and build some awareness around our alignment by using the 6 places of balance from a body mapping tradition. This is actually also in the book, What Every Singer Needs to Know About the Body. Body mapping grew out of the Alexander technique. It was William Conable who developed this system. And it's a method of building body awareness and ease of movement by learning very accurately about one's anatomy and physiology. I'm going to move through this fairly quickly, but you can take this exercise and experiment with it at home. Be sure that you use your hands to palpate and that you have a mirror or a video camera to use to look at your own body in context. So from the top to the bottom, here are the 6 places of balance. The first is the atlanto-occipital joint, or the AO joint. This is where the atlas, the very top cervical vertebrae, meets the occiput at the base of the skull. And it's higher than most people think. So all of you take your pointer fingers and stick them in your ears, right in your ears. And if they were to continue right to the center of your head, the point where your fingers come together is where your atlanto-occipital joint is. And if you do a little head bobble here, you can think to yourself, okay, I am tilting my head on the AO joint, which is right between my ears, where my cervical spine meets my skull. That's point 1. Point 2 is the point at which your arm structure emerges from your shoulder girdle, and we're going to leave this for last. We're actually going to map that or put that into alignment, if you will, last. So let's go down to number 3. Number 3 is your thorax in relation to the lumbar spine. So this is the area where that inner curve of your lumbar spine changes to an outer curve in your thoracic spine. And in order to find the balance at this point, I would recommend thinking about how your rib cage is balanced over your pelvis. Are you someone who likes to thrust your ribs forward or tilt the upper part of your thorax back? See if you can find a way to balance that rib cage over your pelvis in such a way as to make it feel easier with regard to gravity. The fourth point is your hip joint, ball and socket joint, where your femur inserts into the pelvis. And this is where your spine takes the weight and distributes it evenly into your two legs. This tends to be lower than some folks think. So I would recommend using your hand. Right now I'm like moving my leg all around down here and palpating my hip. Use your hands to find where that ball and socket joint really is. Then we go down to the knee joint, which is where the femur meets the tibia, right behind your kneecap. And finally, the sixth point is your ankle joint, where the two lower leg bones, the fibula and the tibia, meet to the talus bone of your foot. And those are just below the bony protuberances on the inside and outside of your ankle. And then once you feel that you've gotten most of those 5 points lined up with regard to gravity, or if you're sitting, you can do the hips up, then think about how your arm can be at ease at your sides, right? Okay, now, here's another option. In the yoga tradition, you can find a similar sense of alignment by practicing Tadasana or mountain pose from the yoga tradition of asana. In this practice, you build the pose from the feet up, or if you're sitting, from the seat up. So Alexander technique is a very top-down modality. Yoga is a bottom-up modality. I personally do better with the bottom-up modality. I like to feel rooted. And then it's easier for me to feel balance once I understand what's going on at the bottom. But everyone's different. Now, speaking of feet, as a yoga teacher and practitioner myself, I could talk about feet all day long and how it has to do with your breathing and your alignment and your singing, but I'll keep it brief. I want to point out that if you are a person who normally stands on your feet, it is well worth your time to spend as much time as possible barefoot or in socks. Shoes with any positive heel change the shape of that change the shape of our feet. They throw off our skeletal alignment and they cause all kinds of body compensations up the chain. And since we're talking about feet, and I promise I'm getting to the end, don't forget about your fascia. Come on, slide. Fascia is also very important to us as people who want to be in alignment and use lots of different body parts at the same time. Fascia is a connective tissue that encases pretty much all of our internal parts, our organs, our muscles, our nerves, everything. Tom Myers, an incredible anatomy and physiology guru, has coined the term anatomy trains, and he published a great book on the subject, which is also listed in your handout. And his core work is on the fascia and how it interconnects our parts in these very long segments. He likens these trains of interconnected parts, all wrapped in fascia, to long links of sausages all twisted together in the same casing. If you squeeze on one sausage, the next one's going to be affected and on down the line. Well, the same is true of our parts that are interconnected by this web of fascia. So for example, if you have stiff and swollen fascia on the bottom of your feet, plantar fasciitis, anyone? I know I've had it. You might feel effects from that stiffness and inflammation up the chain of that particular line of fascia, and that could include your legs, your torso, your neck, and your head. And also, that whole wearing shoes with positive heels thing can affect these fascia trains as well. So since basically all of my students wear positive heeled shoes, I have all of them, when they come into my studio, remove their shoes, as long as they're comfortable doing so, and do some myofascial release on the bottoms of their feet with some balls specially designed for this. Here's an example of one of those. This is from Tune Up Fitness, which is included in your handouts. Usually after doing this for a while, they notice that their body starts to loosen up. Another great corrective exercise for those of you who wear heels or shoes with heels is to do calf stretches. And you can really do that with anything. If you have something that's a couple to 3 or 4 inches tall that you can put your toes on and stretch that back of that calf muscle out, that can be very helpful for undoing some of the effects that wearing positively heeled shoes might cause. Okay, I'm going to leave it there today. We covered a lot of ground. We talked about the physics of breath, the bony structures of breath, the muscles of breath, different patterns of breathing, how our overall alignment fits into the picture, and some interesting cross-body connections. Now, everyone, take a deep breath in and breathe out slowly. Good breathing is the foundation for all other aspects of singing. An adequate, accurate map of the structures and movements of breathing will help singers reach their full potential. As we refine our breathing map, we also refine our phrasing, tone, diction, so that we can follow our innate artistic impulses to new heights of expression. And isn't that what it's all about? We want everything to function optimally so that we can have more fun making our art. And with that, I thank you for listening, and I will take a few final questions.
We've gotten a couple just in these last moments here that I haven't had a chance to read. Thank you, Paul. This is great. We need to do a theme about apparently a whole day about feet. Feet and singing. I can see it now. So I want to ask a question of my own, and then I'll skim through those that have been asked here too. And another system of breathing, you talked about other options, like with the belly breath and clavicular and all of that. Mm-hmm. I've also been taught one that involved basically relaxing the lower abdominal muscles so that all the guts, everything in there, lowers rather than comes forward. And then in order to exhale, one lifts that muscle, essentially lifts everything up from below the diaphragm. Does that create other variables to this, or what's your experience with that technique?
So that sounds like something that might involve training your pelvic floor muscle as well, which can be extremely useful and for some bodies important. Because of variations in body shape and also muscular tone, that type of breathing might not work for every body. It also might be something around kinesthetic sense, right? Some folks have really good kinesthetic sense of their lower abdomen area and their pelvic floor muscles. And some people have almost none. And it's not because they're bad at it. It's just that's the way they're wired. So I think that could be a very positive and helpful aspect to your breath and your the shapes that you make as you breathe. But for other people, it might not.
Like you say, everybody has different, their body's built in different ways. The different types of breathing can be more organic to them. Fascinating.
Yeah.
Good. A point was brought up to back to the asthma topic. Yeah. That one of the principal problems with asthma is that it's actually that the air has trouble getting out of the body rather than in. You talked a little about the inhalation. Are there adjustments that you would recommend, again, for those with asthma? I don't want to get too much into the rabbit hole.
Everyone is a little different in how they respond to it. But I can say I have had some students have to work through asthma and issues that arise from asthma. And one thing that has been very helpful, and this comes from the Sarah Witten workshop that I have gone through the workshop and I've used it with some of my students. And that is in various positions, so maybe laying on the floor, maybe sitting in a chair, and also maybe standing up, doing exercises with breathing that do focus on slow, steady exhalations. So things like making a point of friction, like an F sound perhaps, and hissing out the breath in such a way as to focus it to make a flame flicker or something like that, so that you have a very specific focal point. You're building awareness around the use of that exhalation, and you're working on being able to control that exhalation, but being mindful of also activating that stress response, right? So if you notice that you're going into your fight, flight, or freeze mode and you start to feel an anxiety response coming on, let it go and come back to it a little later. that's just one thing that I've used that's been successful for some of my students experiencing that.
I'm sure none of us have experienced anxiety just from singing on its own. So there's that other variable.
Never.
We have some great two suggestions of things that have worked well for people. One person who's an avid golfer talks about a particular variety of golf shoes that have natural heels. Someone else has a great suggestion about a particular exercise they do, standing barefoot with eyes closed, to find those different points of balance.
Yes, that's great for proprioception.
Is what?
It's great for proprioception, building your sense of where you are in space.
Fancy word. Proprioception, I love it. Yes, and it's just, walking around, staying in balance, still eyes closed. Within about 4 steps, you can kind of feel how things behave differently.
Yeah, great.
There's one final question here, and from someone whose voice teacher emphasizes the epigastrium. How does that fit in?
It's not something that I focus on in any particular way. It may be something that's very particular to that voice teacher, and that voice teacher has a very good kinesthetic sense of that, and that she can feel that engaging as part of her breath support system or breath management system. It is something that does come up commonly, so it's not unusual for someone to talk about that. I'm not going to say, yay, that's great, or I wouldn't do that, because I think it really depends on the person. So if that's something that really does connect to you, and it seems to make an improvement in your breathing, and it helps you to find your optimal process, fantastic.
All right, I think that's a good spirited way to conclude. Thinking right away, it's all about flexibility and having the knowledge of the anatomy so that any singer can experiment and see what works. Thank you, Holly, for this magnificent presentation. I'm not the only one clapping now, I'm sure. Thank you also to all of our participants for some really great questions and contributions. You can help to create more sessions of the Emerald Choral Academy, everyone, by donating at emeraldensemble.org. The next session will take place on Thursday, September the 3rd, later in the evening at 6:00 p.m. Pacific time. And I am told that our instructor for that next session has seen both of your 2 sessions, Holly, and is quaking in his boots of being able to live up to your level. I know that because the next instructor is me, and I'll be teaching about practical score markings.
I'm terrible at marking my score, Gary.
You're what?
I'm terrible at marking my scores.
Well, I'll fix that. No, I kid. No, it's weird to me to be thinking that I'm presenting something called practical, but there it is. Registration is already available at emeraldensemble.org. I hope you can join us for that, everyone. In the meantime, I am Gary Cannon, and on behalf of all of the Emerald Ensemble, I wish you good physical, mental, and musical health. Thank you very much. Stay safe, everyone.